Which of the following is not a specific feature in making the diagnosis of a dystrophic curve in neurofibromatosis type 1? A. Penicilling of the ribs. B. Scalloping of the vertebra. C. Widening of the foramen. D. Thinning of the transverse process. E. Vertebral rotation. And the answer is E. Vertebral rotation. Okay? Neurofibromatosis 1 and F1 diagnostics criteria according to the NIH Consensus Development Conference Statement 1987, the diagnostic criteria for NF1 are met in an individual if 2 or more of the following are found. 6 or more caveolate macles over 5 mm in greatest diameter in prepubertal individuals and over 15 mm in postpubertal individuals. 2 or more neurofibromas of any type, or 1 flexiform neurofibroma. Freckling in the axillary or inguinal region. Optic glioma. 2 or more leech nodules, iris hematomas by slit lamp examination. A distinctive osseous lesion such as phaenoid dysplasia or thinning of long bone cortex with or without pseudoarthrosis. A first-degree relative who meets with the diagnostic criteria for an F1. Scoliosis is the most common spinal deformity observed in an F1, and approximately 2% of all pediatric scoliosis cases are associated with an F1. Scoliosis in an F1 can be further divided into non-dystrophic or dystrophic type. Non-dystrophic scoliosis in an F1 mimic idiopathic scoliosis in general population, but typically presents earlier. Dystrophic scoliosis involve dysplastic osseous changes with rapid onset and progression. Or coronal spinal decomposition in NF1 neurofibromatosis type 1 is generally classified into non-dystrophic and dystrophic type based on the absence or presence of skeletal dysplasia on plain radiographic evaluation, with the clinical and radiological features in the non-dystrophic type being similar to idiopathic scoliosis. The dystrophic features include vertebral scalloping, either posterior, lateral or anterior, rib penicilling or spindling of the transverse process, wedging of one or more vertebral bodies, paraspinal or intraspinal soft tissue mass. A short curve with significant apical rotation occasionally leading to sublux or dislocated vertebral bodies. Foraminal enlargement and defective pedicles. Dystrophic changes are thought to be either intrinsic in origin or associated with intraspinal anomalies, namely abnormalities of the dural matter such as dural ectasia or dumbbell neurofibromas extending through the intervertebral foramina and causing foraminal enlargement. When a combination of 3 or more dysplatic features was present, the risk of curve progression was significantly increased in 85% of patients. while red penicillin was the only singular dystrophic factor statistically influencing the risk of scoliosis deterioration. Okay, thank you.